So quickly talk about a very popular test that is always done at the microbiology um, lab, or it could be the chem part lab, right? Just know that it's done at the laboratories in the hospital. And this is the OGTT. You always see doctors writing OGTT. So what it simply mean is what? Oral glucose tolerance test. So for the oral glucose tolerance test, you basically drink glucose, and after some time, your blood is tested to see the levels of this glucose in your body. All right. So let's have it. We'll define it. We'll talk about the indications. That's when to do this type of test. We'll talk about the preparation of the patient. We'll talk about the procedure, then the interpretation of results. All right. So for the oral glucose tolerance test, it is a medical test used to assess the body's ability to regulate what glucose levels after you consume a sugary drink. All right. So this test can help us diagnose things like what? Basically, disease conditions that are related to glucose abnormality, like diabetes, prediabetes, and impaired glucose tolerance. So indications. When should you do this type of test? If you want to diagnose for diabetes mellitus, or if you want to screen for prediabetes and impaired glucose tolerance, if you want to monitor glucose metabolism in pregnancy, that's what gestational diabetes. If you want to evaluate glucose tolerance in individuals with risk factors like obesity, or people who have what family history of any glucose related what disease condition. All right. Preparation is you ask the patient not to eat for 8 to 12 hours. So they should not do any strenuous activities or caloric restriction. Okay. No medications should be given after glucose metabolism if possible. All right. Then pregnant women should, basically, all right. That is just the preparation of the patient, right? Then what is the procedure like? After the patient has not eaten for like 8 to 12 hours, you test their blood to check for the glucose levels. That's a baseline blood sample. Then next, you now give them a glucose meal. Okay, this is a glucose meal. All right. So you give them a glucose meal that will be about 75 grams to 100 grams of glucose, right? Now, you now do a test that's after 1 hour. They also do a test after 2 hours. All right. So optionally, you can do additional blood samples at 30 minutes, 3 hours, and 4 hours, right? But the standard one is after 1 hour and after 2 hours. So what is the interpretation of the results? So for normal values, your fasting glucose, that's the baseline now, the one that I told you, you do it before even giving the patient the meal, should be less than 100 milligrams per dl. Your 1 hour glucose, that's after 1 hour, should be less than 180 milligrams per dl. Then after 2 hours, should be less than 140 milligrams per dl. But in situations where your glucose levels are higher than these things, it means that you have a problem with insulin. So insulin is not being secreted enough. So now you are having what? A low breakdown of what? Glucose, right? So that's it for the oral glucose tolerance test. Indications, preparations, procedures, and interpretation of results.